The next speaker will be Jayesh Dhanani on experimental models for preclinical studies of clinical pharmacokinetics. Please.
Thank you, Jan. Thanks for having me here today. The talk for today for me is on experimental models for preclinical studies of clinical pharmacokinetics. Understanding drug metabolism and pharmacokinetics are crucial in terms of understanding optimization of the drug therapy in patients for clinical outcomes. And certainly the preclinical studies actually have an important role in the overall drug development towards up until sort of the post-market studies as well, but also even after the marketing is done actually and drugs are actually in the system. Newer interventions such as extracorporeal therapies, for example, are introduced for clinical management, which could impact on the drug delivery and drug pharmacokinetics. And therefore, preclinical studies assist in understanding through mechanistic studies the influence of each of the different parameters that affect the drug metabolism. Experimental models that help you in understanding the overall effects are in vitro, in vivo, ex vivo, and in silico in nature. And in my area of research, which is predominantly critical care type research, and in particular nebulized research, nebulized drug delivery research, these different aspects of research end up forming the incremental model of research. And so in vitro, for example, there are different aspects for the in vitro models. We can actually do a lot of studies in the cell culture medium, for example, or bacterial culture medium to test a combination antimicrobial therapy. For nebulized drug therapy, we are able to actually use particle sizes to assess the amount of drugs that can be delivered through the ventilator using a nebulized route of drug delivery. And then that helps you then in understanding whether the dose can be adjusted using separate ventilatory parameters to affect or improve drug delivery in general. When we come to in vivo animal models, this poses a significant challenge because there are ethical challenges associated with animal studies, as well as the issues around translation of data through animal studies into clinical research. But even so, the animal studies actually contribute significantly to the understanding of drug metabolism in vivo, which cannot be done safely and effectively in human models. In nebulized research, actually, it is important that we use the right animal models. Sheep and pig are known to be better animal research models for studying nebulized drug delivery. My study involving inhaled tobramycin involved using sheep model, and it actually assisted me understanding the drug distribution into the different aspects of the lung, actually, when they're mechanically ventilated. And also using lung microdialysis, we ended up doing a significant amount of pharmacokinetic work actually in a healthy sheep model, which helped us understand optimization of drug delivery in the lung. Now, the new chip of the block is literally the organ and a chip model, which is the ex vivo 3D printed organoid models. And so what it actually involves is using CRISPR technology. We could actually use inducible pluripotent stem cells to direct delivery of or development of an organ on a chip, which allows understanding of drug disease pathogenesis as well as in effect of different pharmacotherapeutic agents, especially when it comes to difficult to access tissues such as lung, liver, brain, and heart actually in particular. And so this is a study that we are currently undertaking actually, which is using a lung model actually, which has been infected with SARS-CoV-2, and we are delivering antiviral agents to understand the clinical effect of that, as well as from the safety perspective, we would be also looking for cytotoxicity and multi-omics analysis. This study is done, we are sort of just in a process of analyzing the data, but again, mechanistically, and scalability perspective, this model actually achieves outcomes that cannot be achieved in a timely manner when we're doing direct clinical trials. The isolated organ perfusion studies form a separate niche of its own. And what this is on the left-hand side, for example, we could see that there is a small mouse heart that we've been able to perfuse, and actually it's a functioning organ, and various different interventions could be performed to see the clinical effect on those organs. Certainly, there are now clinical applications for this technique as well. In particular, for organ transplantation, actually, we'll be able to use the isolated organ perfusion model actually to look for efficacy of a transplanted lung or heart actually before it is actually implanted into the actual patient itself. Ultimately, combining all the data that is obtained from the other studies, such as the in vitro, the animal models, as well as the ex vivo type studies, could be integrated into a computerized model actually in future, which could potentially even substitute the need for animal studies. And when we look at the advantages and disadvantages of all these models, certainly one size does not fit all. So it all really depends on what is the question asked, actually, that chooses what model we would be using for the clinical research. And in future, actually, I would think that the advancement of the in vitro and ex vivo models would certainly, in the process, would certainly have a better effect on improved fidelity to simulate different human organs. And using AI to personalize the medicine using the preclinical study data would be the next level up. And certainly computational models, there's no substitute to that actually in the future, which I do believe that they would reduce the reliance on the animal models. So in conclusion, I do feel that experimental models form crucial component of the preclinical studies involving antimicrobial therapy. All the diverse models involved in the preclinical studies in total combine to provide a comprehensive data, and then future models which would involve refined advanced technology with personalized medicine will certainly enhance the accuracy and relevance of the preclinical studies.
Thank you. That was wonderful, this insight in the fascinating world of experimental studies.